Good evening, everyone. I am Dr. Madhu Pauja, MD Homeopathy and Panel Consultant at Diabetes Free Forever, Chinchwad. Today, I'll be giving you a small insight about B12 deficiency and its implications on diabetes. So, B12 deficiency is basically a result of two main causes. First is improper nutrition, and second is impaired absorption. Improper nutrition means that there is fundamentally a lack of B12 in your diet, and improper absorption means that though you are having a good amount of B12, but there is some problem with your absorption, which means that there is some problem in your gut and the stomach, which is not allowing your B12 to get absorbed in the body. There are two basic classification of B12 deficiency. One is action on nerves and second is the action on blood. So B12 basically helps in the rejuvenation and the healthy working of your nerves, and its deficiency leads to permanent damage to your nerves. It could lead to tingling and numbness, and action on blood leads to anemia. So the symptoms of B12 deficiency mainly are anemia, having skin problems, ulcers, tingling and numbness, and fatigue, weakness and headache. So talking about the sources of B12, does it mean that if you are vegetarian, it will always lead to B12 deficiency? No, that is not the case. The first and the foremost source of B12 is your gut bacteria. Your intestine have the power to produce B12. But when this source is deficient, that is when you need an extra or a fortified diet which is fortified with vitamin B12. So the first and foremost is your soya milk, then comes your green leafy vegetables, third important source is your fruits, and after all this, if there still the deficiency persists, you need to take help of supplements, which are basically multivitamins and your B12 injections. So what does it mean that when I say that there's a link between B12 and diabetes? So a lot of people don't know this, that ingestion of metformin, which is an oral hypoglycemic drug, also leads to a deficiency of B12. Hence, you may notice that a lot of diabetics have this problem of neuropathy, which is tingling and numbness in the feet, which is due to B12 deficiency. So this was a small glimpse I gave you about the causes, the sources, the symptoms and the treatment of B12 and its link with diabetes. Thank you so much.